frame.
Okay.
Whenever you're ready.
All right, so first I would start by disclosing my patient. And according to the case study, she has 65% plaque index score. And basically what that means is that you have 65% of your mouth has plaque and a buildup of bacteria, and we like to call that biofilm. And so what happens is whenever you kind of don't brush your teeth properly, bacteria starts to kind of build up in and around your gum line and around your teeth. And as that buildup is left there throughout the day, it starts to create this biofilm and just a lot of buildup on and around your teeth. And so, according to your medical history, you have a history of diabetes, and you're taking medications for that. And so diabetic medications are known to cause xerostomia, which is dry mouth. And you said for your chief complaint that you came in here today because you're dealing with bad breath, and so bad breath is typically known to be associated with dry mouth. And so I would want to recommend, maybe I noticed that if I was looking through the habits tab, that you like to suck on mints because of your xerostomia and your dry mouth. I would probably want to recommend something less sugary, because with the dry mouth and with the sugar mints, that can definitely cause some decay in your mouth. And so maybe try to chew on maybe some sugar-free gum that has xylitol in it to help with your dry mouth. And definitely trying to drink plenty of fluids and water throughout the day. And then you also have medications for your depression and arthritis, and so antidepressant medications can also be causing your dry mouth. And with your arthritis, that definitely limits your dexterity and hinders your ability to be able to effectively remove the biofilm and plaque that has built up around your teeth. And so today, in a little bit, I'm going to show you some ways to kind of better remove that biofilm. And I noticed that you were interested in a power toothbrush. I definitely would recommend that to you. And so with that, we don't have a power toothbrush in here, but we are going to pretend that, let's do this one because it's circular. Do these come off, or do they?
Yes, they do.
Oh, they do, okay. There we go, okay. So if we pretend that this is a power toothbrush, what you want to do is, since it's a power toothbrush, it's kind of like doing the work for you. And with your limited dexterity, this will definitely help you to better effectively remove biofilm. So you're just going to kind of hold it right here and just kind of let it spin. And you're going to go all the way around the tooth. And what I like to do, because I personally use a power toothbrush, is I like to do one tooth at a time and make sure I cover all the surfaces. That way, by the time I get through the whole mouth, I don't miss anything. And so I kind of just go on this outer surface, and then I like to do on top of the tooth, and then I go to the tongue side of the tooth, and then I move on to the next tooth, and I do the exact same thing, and I come back on the other side. I'm going to do that all the way around the mouth. And when it gets to your front teeth, it's a little bit different, just because it doesn't necessarily have a surface on top. But what I like to just do is kind of hold it right here, and then just kind of go on the back side. And then I would have them demonstrate that back to me. And then for flossing, I noticed that you don't floss, and with your limited dexterity, that's kind of hard for you. So what I want to recommend is, let's see. So since this patient doesn't have a lot of teeth, and limited dexterity, I would try to recommend a floss pick, and they're very cheap at like Walmart. You can get them like at Walgreens, like any store almost has floss picks. And what I want to recommend is if you can just lightly squeeze it together like this, that'll help to create the C shape, because for people who are able to floss, we like to kind of like make a C shape around the tooth. And so with these floss picks, if you just kind of squeeze it just slightly, you can kind of create that shape. And you want to basically just kind of go down. You don't want to force it down. You just kind of want to like slide it down, and then you can just kind of like hug your tooth and do a couple up and down strokes like that. And you can do that all the way around your mouth like that. And this way it doesn't really take a lot. You don't need like much dexterity in order to do this. So, and it's really easy and efficient at removing plaque that likes to kind of get in between your teeth. And then I also would recommend you could use toothpicks, because everyone around their house, you have toothpicks, and so you can also take a toothpick and just make sure to not put a lot of pressure, but if you very carefully just kind of follow around your gum line, you can remove the plaque that likes to build up around there. And doing so will help to decrease your chance of decay, and especially since you have the xerostomia, that increases your chance for cavities to develop. And so when removing the plaque and the biofilm, that will lessen your chance of that, and will also help in decreasing your bad breath as well. And so, let's see. And then, according to your x-rays, it also looks like you have some bone loss. And so that is related to all of that biofilm build up. And what happens is with the plaque build up around your teeth, it kind of causes your gum line to kind of recede and kind of go down, which also causes your bone to decrease as well. And so if we take care of that initial factor of the plaque buildup, that will definitely help to arrest your bone loss and to prevent any further bone loss from developing. And then that will also help to decrease your pocket depths, because whenever I took measurements with my probe and took measurements of your teeth, you did have some areas of 4 to 6 millimeter pockets, and you had some localized areas of 7 millimeters, and that is due to your bone loss and your gum line receding down. And your tissue is a little like swollen, and that is due to like the irritation of all that plaque buildup. So definitely that initial removal of all of that plaque and biofilm will definitely help to take care of all of the problems and things that are like going on in your mouth. And I think that's about it.
What's the last thing you do before you dismiss your patient?
I would document what I talked about with OHI.